Ever wonder what those 3 letters on your insurance card mean? Stay tuned to find out. All right guys, welcome back to the Health Insurance Basics series. So last time we talked about different health insurance terms like premiums, co-pays, deductibles, co-insurance, and max out of pocket, all that fun stuff. So this time we're just going to talk about networks. So let's get right to it. So 3 networks we're going to cover today is HMO, an EPO, and a PPO. So the first one we're going to talk about is an HMO. This stands for Health Maintenance Organization. So the best thing to know about an HMO is that you have to see a provider in network to get coverage. So it's not great for travelers because it's based on your local zip code. So it's the smallest network, it's local, and you have to see a provider in network. If you see a provider out of network, you're not going to have coverage. Now, there is a caveat for that. If it's an emergency situation, life-threatening, there's usually coverage there. But in general, it's not going to be the network you want for travelers. So no out-of-network coverage. Another thing is you need a referral to see a specialist. So say you need to see a specialist for whatever reason, you're going to have to go to your primary care first, pay a copay, then get your referral over there to your specialist. So that's the main things you would want to know for an HMO network. Next is an EPO network. So this stands for Exclusive Provider Organization. So this is a little bit bigger of a network than an HMO network, but this is still very local. It's still based on your zip code. So again, not great for travelers. Now, the main difference with an EPO network is you're not going to need a referral to see a specialist. So that's good. That'll save you some money there. But again, not great for travel. And generally, there's no out-of-network coverage. So unless it's a life-threatening situation, again, then a lot of times you're going to see an out-of-network provider and you're going to have to pay full for that. So a lot of times too, with both of these networks, sometimes it's hard to find a provider in network. So that can be a challenge too. Now, these EPO networks, a lot of times the ACA plans run on EPO networks. So we'll do a video on ACA plans because that's a whole different topic. But what I want you to know for this video is it just stands for Affordable Care Act. It's also known as Obamacare, the Marketplace. These are federally facilitated plans, right? So they have certain mandates of things they have to have in the plans that they have to cover. But the thing to know about it is that based on your income level, you can get a subsidy, which is basically a discount on your monthly premium on ACA plans. So, you could pay anywhere from $0 on ACA plan up to $1,000 if you get no, or even more if you don't get any subsidy at all. It all depends on your household income. So, but again, a lot of times they run on this EPO network. So the last network we're going to talk about is PPO. So this is the one you usually want if you can get because it's the largest of the 3. So with the PPO network, it's going to travel with you nationwide. Another thing too is there is out-of-network coverage. So that's always good. If you have to see a doctor out of network, you're going to have some coverage there. Now, you still want to see a doctor in network because what you get with a PPO is you get a network discount because they have what's called pre-negotiated rates. So say Dr. Smith over here has a deal with the Cigna PPO network where for a visit or a procedure, he can charge $350 and they're going to pay $260, and that's the max. So he understands that the max he's going to get out of that is $260. So you get this network discount. And also too, with the out-of-network coverage, it's not generally hard to find a doctor, in a PPO network because it's so broad and so expansive. So you don't really have to worry about seeing doctors out of network anyway. And again, just like an EPO, there is no referral to see a specialist. So generally, the PPO networks have the highest premium. But a lot of times, like I said, with these ACA plans, if you don't get a good subsidy, which is that discount on your monthly premium based on your household income, this premium can be really high on these ACA plans, and they're usually EPO networks. So anyway, now another thing I want to say is what I discovered as an independent broker is a lot of times the carriers, I don't want to mention any names, but the big name carriers, they can sometimes charge more just for their name. So the thing to know about health insurance is that it really doesn't matter so much what the name of your insurance company is. What matters is what the network is. And the reason that is because that's how your doctors and hospitals get paid. So that's what they're going to care about. So a lot of times what I see is the bigger names will charge more for essentially the same benefits. So that's just something to keep in mind if you're shopping around, if you're working with a broker like myself. I'm always going to try and find you the plan or the carrier that's going to give us the highest benefits for the lowest cost. And the biggest thing you got to know when you're looking at a plan is what network do you run on. So if you're working with a broker, always ask them, what is my network? Because that's what you want to know, because like I said, that's what the doctors and hospitals take. All right, so that's going to wrap up today's video on networks. I hope that helps you better understand those 3 little letters on the back of your card. Again, if you have any questions about your plan, reach out to me as a broker. I will look at it and be able to tell you either yes, you should stay put, that's the best plan for you, or no, we've got some options over here that I think look a lot better, can get you higher benefits for the same cost, or we can lower your cost for the same benefits. So that's the advantage of a broker. I have all the options. But anyways, I'll see you guys in the next one.